Welcome back. In Module 2, you are now ready to begin Part 4 of Module 2, the Working Environment. Musculoskeletal. We will be talking briefly about the basics of the musculoskeletal system and the range of motion exercises that nurse aides can do for residents. Objectives. Discuss the causes of postural changes in the elderly. Discuss the role of the nurse aide in prevention of contractures or foot drop. Discuss guidelines for range of motion, ROM. Functions of musculoskeletal system. Our musculoskeletal system is composed of muscles, bones, joints, tendons, and ligaments. This gives our bodies shape and structure, allows for movement, protects vital organs, and generates heat. Our bones are also responsible for storing minerals such as calcium and phosphorus, and actually produces some blood cells. Our bodies will change over time. As we age, we will gradually lose our muscle strength and tone. This doesn't mean that all older persons are weak, but the majority of older people will see a decrease in their strength and tone. Muscle mass may also decrease, causing weight loss because muscle weighs more than fat. Bones tend to get more brittle with age, but calcium supplements may help maintain some calcium levels in the bones. The gradual shrinkage of the space between the vertebrae in the spine will show a decrease in height. That's right, we do shrink as we age. Humans can experience many disorders that may cause postural variations in their musculoskeletal systems. Arthritis is a very common disorder that causes inflammation to the joints that may cause pain, stiffness, and swelling. Two common types of arthritis are osteoarthritis and rheumatoid arthritis. Osteoarthritis is a condition where the cartilage between bones erodes away. Rheumatoid arthritis, which can be the most crippling, is an autoimmune disorder that causes the body to attack its normal tissue. Osteoporosis is the condition in which the bones lose mass, causing them to be brittle and easily break. A lack of calcium in the diet and lack of regular exercise are two examples that cause osteoporosis. A contracture is a permanent shortening of a muscle or joint. It can occur by not moving that part of the body, causing the body part to be permanently frozen. Pain can prevent body movement, causing a person to alter their posture. Many older people, those 80 and above, exhibit a change in posture. Observe the older population next time you are out and about. Do you see them with their head and neck flexed slightly forward, with their eyes focused on the ground? Is their spinal column flexed forward? Are they slightly flexed at the hips and knees as well? Or do they stand straight up? This is a picture of a therapy room, and now we're going to talk a little bit about therapy. Rehabilitation is care used to restore a person to their highest level of functioning possible after an accident, illness, or injury. For rehabilitation to succeed, all staff members, that's you, must work together to return the person to the highest level of functioning. The health team works to maintain or help regain abilities of the person while trying to promote independence. The therapy will also prevent complications of immobility such as contractures. At some point, the goals of rehabilitation will be met, and then new goals are set to maintain those current abilities using restorative care. Restorative care may be part of a nursing assistant's responsibilities. All restorative care needs to be doctor approved. Range of motion exercises are exercises that put a joint through its full arc of motion. The goals of managing range of motion exercises are to decrease or prevent contractures and atrophy, increase the circulation, and improve strength and movement. There are three types of range of motion exercises. Active range of motion, AROM, are done by the resident without any help from us. Active assistive range of motion, AAROM, requires some assistance from staff to help the resident. PROM, passive range of motion, requires staff to do the exercises as the resident is unable to do them. In class, we teach you how to perform passive range of motion and typically refer to it as range of motion. Body movements have specific medical terms. Abduction is moving away from the midline of the body. Adduction is moving towards the midline of the body. Extension is straightening a body part. Flexion is bending a body part. Dorsiflexion is bending backward. Rotation is turning the joint. Pronation is turning downward. Supination is turning upward. Opposition is touching the thumb to any finger. Here are a few guidelines when performing range of motion. Always follow the care plan. The care plan is based on the doctor's or physical therapist's orders. We cannot change this plan without their approval. Proper body mechanics can include raising the bed up to a waist-high level so we don't have to bend over, allowing the resident to do as much as they can, and bending at our knees. Keep a specific order when doing the exercises so you don't forget part of the exercise. A general rule is to start from the head and work down toward the feet. Support the joint that is being worked with. This is extremely important for those joints that are stiff and sore. Never force a joint to go farther than what the resident can move it, meaning do not go past the point of resistance or if they have any pain. Some residents require walking aids. Walkers offer additional support and are used when a resident can bear some weight on their legs. When using a walker, the walker is moved first, then the weak leg, then the strong leg. Encourage residents not to hang items on their walker. Many residents have pouches on the walker, so they are able to carry items with them. Encourage these residents to keep the pouches light with just a few items. Canes help with balance. Residents should be able to bear weight on both legs when they use a cane. The cane should be held on the stronger side, and if standby assistance is required, the staff member should stand on the weaker side while the resident ambulates. If the resident is experiencing pain, have them sit down on a chair or bed. If the resident is experiencing shortness of breath, also do this. Positioning devices aid in proper body alignment and positioning. One type of device is a footboard. The footboard is a padded board or pillow-like device that is placed up against the resident's feet to keep them flexed and properly aligned. This prevents foot drop, which is a weakness of the muscles in the feet and ankles, causing them to constantly, if not permanently, be extended. Contracture. As mentioned before, a contracture is a shortening or thickening of ligaments, tendons, and muscles. This will cause a permanent fixed position. Notice that the image shows the thumb adducting into the other fingers. Sometimes all fingers will curl into the palm of the hand. It is very uncomfortable to have these fingers flexed or extended. Here are a couple of the reasons why contractures occur. The first reason may be that range of motion had not been done enough or often enough, and the joint had not been stretched to its full potential. A second reason may be that precautions were not followed as ordered, such as using a hand roll to keep the fingers from flexing into the palm of the hand. A hand roll could be a purchased piece of therapy equipment or simply a rolled up washcloth. Another reason may be range of motion was not started soon. Contractures may begin as early as 3 days after a stroke or an amputation. Keep in mind not to go past the point of resistance, as this may cause pain. This concludes this part of our Module 2.